Good morning, good afternoon, and good evening, everyone. Thank you for joining the Medical Tourism Association with our live webcast on opportunities in the China's emerging healthcare market. I think of, our association works in over 100 countries around the world. One of the biggest emerging destinations that we think is going to be really the hub of healthcare is China in the next few years, as significant investment occurs in the building out of healthcare, the building of hospitals, retirement, communities, assisted living, biotech, life sciences. There's a tremendous, focus on investment and lifting up the healthcare quality and infrastructure, which presents a lot of opportunities for partnership for U.S., European, and Asian and other companies to work in China with Chinese companies and the government. And then also there's a huge emerging market with Chinese patients leaving China to get the highest quality healthcare in the U.S., Europe, and other destinations. So I'm very excited today to have one of the top experts in China's healthcare market with us on our webcast today. Lisa Hunt is a partner at Jones Day Law Firm in their healthcare practice group, and her focus is in transactions and regulatory work in the U.S. healthcare industry as well as international healthcare with a special focus on China. And I think that, she's, one of those individuals that you're going to see is a power player and a power broker over the next couple of years, really connecting and putting big opportunities and joint ventures together between China and U.S. healthcare organizations and investment companies and others. So with that, I would like to turn it over to our esteemed guest, Lisa, who actually is broadcasting live from our corporate headquarters today.
Thank you, Jonathan. Thank you, Jonathan. Good morning, good day, and good evening to all the audience. And thank very much for Jonathan's invitation and introduction, as well as for the invitation of the World Medical Tourism Association to talk about China and the healthcare opportunities in China. I'm a partner at a law firm called Jones Day, and we have 2,500 lawyers worldwide, with several hundred lawyers full-time in China and about 1,800 lawyers in the United States. We represent large health systems in the United States and internationally, and we do basically is a full-service law firm focusing with a lot of expertise in the China market. China healthcare system is in the process of transforming itself to keep up with really what's going on with the developed countries. So it's no secret that basically there's a scarcity of quality health facilities. And so today we're talking about really more in the healthcare sector rather than the life science or the medical industry. And the healthcare has been, the development has been lacking for decades in China. I think the issues is rooted with, because I think the focus of China in the past several decades have been the manufacturing, has been the technology, and healthcare services have not really been part of the economic reform in China since Deng Xiaoping opened up started economic reform in China in the 1980s. However, we're seeing a significant shift of that focus and changes in China. So let's take a look at really the current Chinese healthcare system and what are we looking at in terms of the healthcare facilities. Most of the hospitals in China are we call public hospitals. They're being managed by the Ministry of Health, which has been, actually the name has changed, or being managed by local governments. So they're in the categories of the public hospitals. The private hospital are actually very much a new development, and we're going to definitely cover those later part of the presentation. So the traditional hospital, there are three tiers of hospital: Tier 1, Tier 3, Tier 2, and Tier 3. So tier 3 are really the large acute care hospital, general acute care hospital. Many times it's more than 500 beds. And another thing that's interesting about China is very unusual for United States is this. In China, a lot of large public hospitals have huge number of beds. It is not a surprise to hear that certain highly reputed hospitals have 5,000 beds, 6,000 beds, 3,000 beds, which is really, in the United States, considered incredibly high number of beds. I think the reason is because, and if Chinese population like to go to hospital for services. And that's really one of the issues in Chinese healthcare system, which I'm going to identify later as well, that is there is a deep distrust of this primary care system, and it's more of a ambulatory care system. Instead, I think even for a common cold or for something that's minor, will be taken care of in the United States by physician, for example. The Chinese population would go to hospital for services. So what we're seeing is really that results in really high number of beds in large hospitals, and many times really the length of stay is a lot longer as well than the developed country. Another thing is really that also because of the scarcity of the beds and quality healthcare systems in China, and that really caused one of the problems really the access to care for the general population is not sufficient. So when people that truly need care, they are not able to access care. And one of the things that we joked about sometimes, we talked about, if you want to really get seen by the physician you want to visit, and sometimes you have to go visit, get that registration number 4 o'clock in the morning and stand around the block, and maybe you get to see the physician at 4 o'clock in the afternoon. And Chinese government recognized that, and the Chinese population, as they achieve certain economic level standards of living, and they feel like that cannot be tolerated as well, and therefore this is what we're seeing significant number of reforms initiatives and the private business activities going on in China. And the next slide, okay, how can I do the next slide? Got it. The next slide, we talked about really the hospitals in China, as you see in this slide. And most of the hospitals are actually located, we call it Eastern Corridor in China, really the more affluent area. And we're seeing development in the green area. And then, out in basically the western part of China, we're really seeing very few quality large healthcare facilities for the population there. As I mentioned earlier, I think that has been changing very rapidly as well. And here I'm identifying really a number of the systems in China, hospitals in China, especially in the Eastern Corridor area, that actually have gotten international hospitals from Joint Commission status. So in terms of the how do hospitals make money? As I mentioned earlier, many of the hospitals are actually public hospitals. So the government actually provides the land and subsidize a lot of the operations for the public hospitals. And there's one interesting change of policy. This is actually a critical factor that basically increased the opportunity for collaboration with U.S. or foreign partners. Is in the old days, I think public hospital are allowed to have the VIP beds. And I would say during the past 5 to 10 years, a lot of the transaction the Chinese public hospitals like doing with the U.S., German, the foreign hospital system is really to establish that VIP wing of the hospital and to take care of really private pay patient, if you may. However, Chinese government is changing that policy, and trying to bring down the number of the VIP beds to be not more than 10% of the total beds. And the reason is this, and I think the reasons are fairly legitimate as well. The Chinese government is saying that I'm the one that provide the land, provide the resources, and subsidize your operation. And so the purpose of the hospital, and this goes back to really China being a socialist country, that the government take on the parental role of providing healthcare services is, so they said the hospital, public hospital in particular, is really for the people. And so the government recently announced the policy of bringing down the VIP beds to not more than 10% of the inpatient beds. And this really results in really a lot of a hospital, public hospital, thinking I am going to basically have less revenue from the VIP beds. So the primary sources of the hospital income are the government subsidy, patient out-of-pocket expenses, and the reimbursement from the social insurance plans. According to the Chinese government, 95% of the Chinese population have actually some sort of insurance coverage, actually. And for any company that operates in China, one of the funds, there are 3 mandatory funds the employer have to contribute, one of which is actually the social insurance funds. And so if we're thinking in the terms of the United States, it will be like Medicare for everybody, all population, including the working population. But I think the coverage is, that's a different story. Everybody has insurance, government insurance coverage, but the level of coverage and what will cover, that's a different issue. And the reform happened in 1997, and that really sets off really a cascade, a series of new laws and regulations and public policies. And so it all starts out in 1997. Many of the hospitals basically went from fee-for-service to a kind of a monthly budget as well from the government. That's actually not that different from the United States, because I think the United States for the inpatient, outpatient went on the prospective payment system rather than on more fee-for-service system. So in order to control the spending, healthcare spending, the government also put the hospital on budget as well. And so how do Chinese hospitals make money? Other than the patient service revenue, one of which is actually pharmaceutical. Pharmaceutical is an important part of the revenue source for many public hospitals. And that has also become an issue as well. Many hospitals actually have built-in pharmacy, integrated pharmacy right at the hospital. And so what happened is really, and after you receive the services, you naturally will go to the pharmacies at the hospital to receive all your pharmaceutical supplies. And in some situations, and I won't say that's across the board, but fairly frequently, I would say hospital actually compensate physicians based upon the pharmaceutical consumption. So as you see, I think Chinese government has, so the pharmaceutical supplies cost, just like United States, is really the #1 driver for the healthcare cost in China. So so we talked a lot about the public hospitals issues, and so I mentioned about basically a lot of public hospital in particular, they view themselves as really part of the government, and in many ways, actually, they are part of a government. So that's why in dealing with or doing transaction with the public hospitals, you got to be very careful as a private enterprise. In terms of not to accidentally violate some of the laws that basically govern public agencies. And so, but naturally they have grown up as part of the government system rather than a corporation that basically had to be accountable for your financial outcome and follow typical corporate governance structures that like the corporations will have to follow. And many of the physical environment of the public hospitals really need to be updated. As I mentioned later in the slides, we're looking at really the spending, the healthcare spending from the Chinese government side among all the countries, large countries. they're really on the low end. It's like 4.6% of the general gross, the domestic gross consumptions. And so we're looking at really compare that with the United States, almost 18%, and still continue going up. So Chinese government also recognized they need to invest not just on the quality of healthcare services, but also the brick and mortar as well. And so this is what we're seeing is really a lot of new development in terms of a new hospital getting built in China or the old hospital getting a facelift. But most importantly is really if you have new brick and mortars, that doesn't really get you the patient population and to deliver quality services. You need that very robust and high quality medical team. And in many cases, the government or the public hospital actually favor the really modern healthcare system being brought in and the expertise brought in by the U.S. hospital and other foreign health systems. And a lot of time and the particular healthcare service, especially those high-end healthcare services, requires out-of-pocket payment. Even though everybody has healthcare insurance, some form of healthcare insurance, but certain procedure, high-end procedure, complicated procedure, actually requires a significant amount of out-of-pocket, and that sometimes means really those kind of services are not necessarily all accessible by the mass population. And this really raised a question in terms of a development of private insurance in China market. And I know that, from various resources, Chinese government is looking at this issue very carefully and how to come up with a private insurance system for the China market, which I think is going to continue to fuel the development of the healthcare sector in China. Many physicians are attached to the public hospital, especially those famous doctors. They don't necessarily want to go provide services in a private hospital, but again, that trend is changing as well, with quality private hospital being developed in China. But traditionally, if you're a good doctor, you tend to kind of just work with one hospital. You're part of that one hospital's workforce. And Chinese law also prohibits physicians from practicing multi-sites. So a lot of times those private hospitals have to recruit retired physicians or try to basically recruit private physicians that are willing to basically leave the public hospital and practice in private hospitals. And but what we're seeing is really, again, that trend is also changing as well, because I think as more and more quality private hospitals getting built or the public hospital getting developed with the help of a foreign healthcare system, we're looking at really physicians also a change of mind as well in terms of how they want to map out their career path, especially this younger generation of physicians. And overutilization institutional care, like I mentioned, 60% of the patient care actually in China is inpatient care, which is exceedingly high percentage by comparing with really the developed countries such as the United States. The distrust of the primary care system, and in old days, the primary care physician, we call the barefoot doctors in China. These folks are not necessarily educated medical professionals, very different from really the very solid, high-quality primary care community we have in the United States. So that's really one area the Chinese government and all the public system, the industry, the experts, are trying to build out. That is to establish this primary care system, family physician system. But of course, that starts with training, appropriate training for the medical professionals, and not just to cover the physicians, but also the allied health professional as well, which is really part of the core healthcare system in the United States. What we're seeing is really the Chinese side is also developing the allied health professionals, the training, accreditation, certification, so that they can be part of the workforce to provide quality healthcare services. And the pharmaceutical drugs and the medical equipment device and lack of finance for large hospital system, all these are really common issues that challenge really the Chinese healthcare system. And here is really just a few facts that many of you are probably fairly familiar with. we're looking at really significant number of population have typical diseases, right? So we're looking at the older population, especially with Chinese demographic policy, that is one baby policy, which has been gradually relaxed by the Chinese government, but it's a generation of just one baby. So what we are living with is really what we are dealing with in China is aging parents without anybody taking care of the patient, the patient parents. And so we're seeing a lot of development of assisted living, like community centers or the retirement community, because I think for the younger generation, when they don't have the ability to take care of the parents themselves, but they have the financial resources, and the parents themselves also have the financial resources as well. That's really, they wanted to design a retirement lifestyle with healthcare services. And disease, the diabetes and the joke is really when McDonald's landed in China, that's when they see the pediatric diabetes issues. And a lot of my American friends would tell me, so how come Chinese eat so much and they don't really gain weight? Actually, they do. They gain a lot of weight. They're dealing with the typical issues that the Westerners deal with as well, the basically lifestyle, nutrition-related issue, especially as they become more modern and more developed as a country. So we're dealing with very similar issue. United States has to cardiovascular disease, cancer, chronic care disease. And the other thing is really the rural units. And it's a major issue for 12, but so the many aspects of the social issues that the Chinese government has been dealing with. Healthcare spending, because Chinese government has not really spent that much money on healthcare services, and there is such demand in healthcare needs. The McKinsey company basically estimated that we're looking at significant investment and spending. And, 1 trillion in 2020 from 350 billion in 2011. So we're looking at the needs in the marketplace that really, we're looking at the greenfield development, we're looking at the brownfield development, we're looking at not just foreign ventures going in, developing the Chinese healthcare industry. We're also looking at large Chinese companies believe that the healthcare industry is one industry that basically will experience significant growth in the next, 20 years. So we're looking at really, just to summarize, why we're looking at the increased healthcare spending. We're looking at really the growing middle income class. One of the simple facts I can share with the audience here in terms of to show the growth in Chinese, the wealth is, for example, I live in Columbus, Ohio, part of the time, and Ohio State University right now has the highest number of undergraduate students among all universities in the United States and among all foreign students as well. And those students usually don't come with scholarships and fellowships, and they really is the private paid students. And so we're looking at several thousand at Ohio State University. We have this growing affluent class in China. They're able to basically have good lifestyle. And once you have that good economic lifestyle, what you want is really you want to make sure you, as well as all your family members and all your employees, if you're, own the big companies, have access to good healthcare services. Because number one, you maintain a healthy population, so you maintain that productivity. So I think we're seeing that increasing demand, not just fueled by really the international company going to China, but also the growing companies, the wealth class, as well as the very increasingly strong middle income class. And we're looking at demand for better healthcare services. As I mentioned, once you have, you achieve certain level of standards of living, you want to make sure that your healthcare services are being provided for. You have a way to get quality healthcare services. And in China, the complaint from many colleagues and friends is really, you have the money, but you don't have a way to get good quality healthcare services. And increase in lifestyle diseases. And we mentioned about really whatever we're having in the United States, and we're seeing really the double increase, cardiovascular disease, cancers, and those chronic disease management needs as well. Aging population, and people are living longer, and without appropriate and sufficient access to healthcare services, I think Chinese government and the Chinese population realizing that we have to do something, and it's not going to be acceptable. So this is we talk about really the affluent classes and upper middle class and in the urban household. And so we're looking at 54% of the urban household, 56% of urban private consumptions here. It's a pretty good slide to give you an idea. And a lot of the time is really, even though, and we have to also recognize Chinese populations are very big on savings as well. So you very rarely you see paycheck to paycheck kind of a lifestyle. Instead, I think Chinese people, they tend to save a lot. And when they do use the money, and they will spend on healthcare spendings, because that's really to either save your life or to improve the quality of your life. So demand for better healthcare services. And we have seen that happening in Beijing, Shanghai, Guangzhou, these really large cities. And what we're seeing that is very encouraging as well is really the level of demand happen in basically, we call it secondary city, but they're really not secondary. They're by comparison, and they're really, usually they fit in the profile of the following. That is, maybe they have 7 to 8 million population, or a 4 to 5 million population, which is considered pretty sizable town by United States standards, and they call it small town there. We're looking at really manufacturing, auto, construction materials, electronics, biotech as well, large campus, and the government or the real estate developers or the public hospital there are trying to basically put in resources so that they can provide better healthcare services for their employees and for their family members as well. And we're looking at lifestyle diseases, and so this is a excellent summary from WTO that talk about really the newly diagnosed cancer cases, and I don't have to share with you that the air pollution, the pollution in the environment in China has been really caused a lot of concerns, and has been described as really the reason that the cancer, the increase in cancer. China has developed basically since 1987 to nowadays really a sizable economy. And I think one of the trade-offs is really the environment and the lifestyles. But I think Chinese government is taking a lot of very positive, progressive measures to control the environment and the pollution. And but again, we're looking at a population dealing with the lifestyle diseases that comes with that economic development. Aging population, we talked about really the 60%, in the United States, we talked about the last 2 years of the older population's life consume really 80%, 90% of the healthcare resources. That's the same thing as well in China. But we are looking at people who are living longer and the aging population, and they have a wide spectrum of needs, not just the healthcare services, but also living needs as well, life needs as well. And so I think that's also go in the Chinese healthcare sector's development. And so we're looking at really not just hospital and primary care settings and other ambulatory facilities. We're also looking at really a lot of nursing home, community centers, assisted living type, with a big healthcare component going up in China. The current trend is this. So what we're seeing is really significant increase in healthcare demand, and the government is rolling out all sorts of initiatives and trying to increase the foreign direct investments in China, or collaboration in China in terms of between the Chinese healthcare facilities and the foreign facilities. And we're looking at introduction of more and more private hospital. And I wanted to say the private hospital nowadays, they're going up right now in China, are different from the first generation of private hospital. The first generation of private hospital tend to be really like the cosmetic procedure, for example, or dental. What we're seeing the private hospital development are the oncology, for oncology services, for cardiovascular services, orthopedic hospital, rehab hospital, and general acute care hospital as well. More and more foreign direct investments. And since 2011, Chinese government has basically passed the law, implemented regulations, and also announced public policy that opened up really the foreign direct investment in the healthcare sector. So 12-year plan, we're all very familiar. It just is a healthcare specific plan. So we're looking at expand the scope of medical facility. Non-governmental enterprise can establish favorable environment for the operation of non-public medical facilities and encourage non-public medical facility to expand their operation and accelerate really the healthcare spending and to increase, projected to be 6.95. But compare that with really 18% in United States. So I think that's really still the room to grow is evident in the Chinese healthcare market. So these are the series of the legal, basically for foreign requirement. This is a series of laws and public policies and regulations that have been basically passed by adopted or promulgated by the Minister of Health. The government has also changed the name as well to, instead of calling it Ministry of Health, called National Health and Family Planning Commission. And the name change occurred in 2013. Based on this name, you see really where the government is heading, and they wanted to basically give a different flavor of the Ministry of Health in terms of the governmental authority. Instead of it just really health, but it's really national health and family planning. And it's really, it allows the healthcare development to be more grassroots, to come from the community. So for example, 1997, foreign, basically that's really the joint venture, but you cannot go over 50%. 2000, the Minister of Health required total investment to be set at the renminbi 20 million, which is not a whole lot if you're looking at that time, the exchange rate is probably 8 renminbi per US dollar. So we're looking at potentially 2 or 3 million in US dollars basically, but it allowed foreign investment to be at a 70%. 2008 to 2011, the government opened up for Hong Kong, Macau, and Taiwan investors to set up wholly owned hospital in several cities. And so now you see some of the first generation of private hospital are actually brought in by Hong Kong, Macau, and Taiwan investors. 2012, and we're looking at changing healthcare environment to basically, and this is very interesting about China, because China is a controlled economy rather than free economy, rather than market economy. So any foreign investment into China require the basically Chinese government's approval. And they publish on an annual basis this investment catalog, basically. So you look at your industry to see which catalog you're in. And the healthcare catalog, healthcare industry used to be in the kind of a restricted category. And now it has been changed. It was changed in 2012 to permitted category. So the permitted category is really, you still need the government's approval for investment, but it's not restricted industry. There's another category called prohibited industry. So industries that have national securities, foreign investments cannot get in. Even though we're saying United States is a free economy, market economy, actually a lot of the investment in the United States actually requires Department of Commerce approval as well. So it's not that unusual, but in China, basically, most of the significant, any actually foreign investment, even your permitted category, still needs government approval, but you are permitted to make that investment. 2013, and basically wholly owned foreign enterprises are allowed to be established in Shanghai Free Trade Zone. And almost all major cities right now have set up the Free Trade Zone, but they are gradually opening up the free trade zone of hospital. 2014, about 2 years ago, the National Health and Family Planning Commission and Ministry of Commerce basically issued Notice 244. And this particular notice is very significant. And again, in China, typical Chinese format, that is, instead of passing a law, it's basically a government policy that basically allow wholly owned foreign hospitals in 7 provinces and cities like Beijing, Shanghai, Tianjin, Jiangsu Province, Guangzhou, Fujian Province, and Chongqing. And so these are the list of the 7 cities and provinces that allow foreign, wholly foreign-owned hospitals. And so these are the kind of more detailed requirements. And I wanted to mention one thing, that is, you can say, so Chinese government opened up the market for foreign direct investment. It doesn't mean anybody can just come in and set up a hospital, because the eligibility criteria in bullet 3 actually is laid out as substantive requirements government wants. That is, you can come in with the money, but if you don't have the ability to have quality healthcare services, to provide quality healthcare services, then we don't think you really meet the eligibility requirement. That criteria is very interesting, just basically simple, but what that means is really the government is saying to the health system in outside of China, say, this really will kind of it's a prerequisite, for any kind of foreign direct investment to link in some way with basically an established health system that has the ability to bring medical technology and medical expertise to the China market. And another very interesting development is really there's no minimum capital requirement for foreign investment anymore. And but we tend to follow the traditional, because when they opened up the Taiwan, Hong Kong, Macau, it was 20 million. And again, but I would have to say, share with everybody almost like all the transaction proposal that we have reviewed so far, and almost none of them require the U.S. hospital to put $1 in China, because I think for U.S. hospitals to invest in a foreign market, there are some issues that concern really tax-exempt hospital in terms of utilizing the resources, tax-exempt resources. So it's a lot of substantive information, but we're going to wait to answer questions at the end of the session. I'm going to turn it over okay, that's still my slides, right? Okay, the way to enter into China market. So many different ways, and I'm going to quickly go over these models, joint venture models, and you can do 50-50, you can go up to as much as 70%. And so this is what we're seeing more common, rather than wholly owned hospital. Not to say it has not happened, but there are a lot of other challenges from basically foreign hospital come in to set up basically your wholly owned system, unless you can make collaboration. You can have collaboration from the Chinese hospital, because as I mentioned, you can have a beautiful building, but if no quality medical professional providing services, it will be impossible to basically deliver the healthcare, right? So joint venture model basically, again, joint venture is like marriage. So how to really work with your partner to make it work. So that's one of the issues. However, if you, and what we're seeing is really many Chinese government actually are willing to be that joint venture partner, or they set up a private enterprise to be your joint venture partner. That actually can be very helpful in terms of expediting the regulatory approval process, and also to make sure that the joint venture hospital actually align with really the government's policy as well. And this is really a model that we're seeing quite a bit. And many joint venture hospital, we're all looking at accomplishing the following, right? So basically, we're looking at specialized services. We're looking at basically providing superior patient services, private rooms, patient-centered care, and we're looking at residential area, or really located right next to lots of expats or international enterprises, and privacy, data privacy, and just basically general privacy. Quality physicians, and we're looking at potentially medical tourism opportunity, telecommunication type. And the other one is more of so the current joint venture, I'm giving a few examples of the joint venture model, United Family Center Healthcare, that's a hospital in Beijing. And the CHC is really interesting because this one is funded by Dr. Tom Frist, who actually was the founder of the HCA Hospital. And so basically, CHC went in a joint venture with the government of Zixi. And Zixi is actually a small city with about 1.4 million population. However, Zixi city is actually located in Ningbo. So it's really one of the wealthiest cities, actually. And it was reported that the hospital was opened in August 2013. And right now, I understand that the CHC is looking at managing or building other hospitals. And we're looking at consulting and management services. And that's really another very popular route many U.S. health systems have been pursuing. And that kind of a match up with really the large public hospitals and either not willing or having difficulty converting into private hospitals or establishing joint venture with a private hospital. So they set up the consulting services. And I'm giving some old examples, the Harvard and Huashan, that's kind of older examples of the management services, wholly foreign owned, and I wanted to say a couple of things about the management companies' management services structure. And we're seeing that being very much more of a prevailing trend, if you may, because it doesn't really require any resource from the U.S. health system. On the other hand, you can actually bring the expertise, and you can establish a telemedicine and also facilitate the medical tourism development as well. Wholly foreign-owned enterprise, and again, that's really, that's basically is a wholly foreign-owned enterprise. And as I said, it's a bit unusual for tax-exempt hospital to set up a wholly foreign-owned enterprise, at least not in the transaction I have seen in the past couple of years. But, you know, not to say it will not happen down the road through some kind of a joint venture entity outside of China. Lease model, this is the VIP win I talked about, and many hospitals manage the VIP win. But this model is going to gradually, I would say, become a lesser. Reason is this because, as I mentioned in the beginning of the presentation, the private hospital is limited to just 10% of the hospital beds. And so that really allowed the U.S. health systems or other foreign health systems to come in to manage that VIP wins opportunity is a lot smaller. Legal issues and typical business license approvals and you know, typical question is really, can you have a foreign physician providing services in China? There's, of course, a way of doing it, but it's not like you can land in China and providing services. I mean, that's the same thing. Chinese physician will not be able to come to the United States and to practice medicine. And just like, you know, Florida physician cannot go to New York to start practicing medicine, the same thing as well. Foreign currency controls. You know, this is an important issue given that basically renminbi, Chinese has a foreign currency control. It's not like you can easily remit renminbi outside of China. Intellectual property rights, many public hospitals in China, and they want to have this IP rights and other issues. And so the question is really, you know, we all have heard about this IP issues in China. So for any health system or any kind of foreign establishment going into China, you need to start thinking about trademark registrations and other kind of IP protection. Material agreements, you want to make sure you have a competent counsel helping you out. Accounting and tax issues, you want to make sure that you don't accidentally become a permanent establishment in China, therefore that have Chinese taxing authority having jurisdiction over your worldwide income. Employment issue. In 2008, Chinese passed the like American-style U.S. The Chinese labor law. So you got to be very careful when you're employing Chinese nationals. And Foreign Corrupt Practice Act. I mentioned large hospitals and physicians. They're actually public entity, public employees. When you are dealing with them, sponsor a trip to the United States, and you may get in trouble with the Foreign Corrupt Practice Act because it's our U.S. government, Department of Justice, actually, you know, will enforce the Foreign Corrupt Practice Act. But on China's side, they're also enforcing the China anti-bribery law as well. So you cannot underestimate the enforcement of these laws, and so you have to not just your core core operational folks, but also people you are dealing with, your distributor, your agents, your representatives. They need to have good understanding of what they can and cannot do in this area. So with that, I'm going to turn it over to Jonathan.
Thank you, Lisa. And thank you for the great presentation. I think it's one of the most in-depth, really descriptions and insights that we've seen on the China market. So thank you so much for providing that. So, you know, to really talk a little bit about some of the things that, you know, the MTA is doing in the China market. You know, the MTA has invested a significant amount of time and money in really penetrating the China market, working with the government in China, and helping create relationships between healthcare providers overseas and the China market, and connections between investors in China and investors outside of China. We started a couple of years ago, and we've been doing trade missions, taking Chinese investors and healthcare groups into the U.S. and into Europe to meet partners. And also doing the same, bringing U.S. and European providers into the China market and investors to look for those B2B or B2G relationships. You know, I think China is going to be one of the largest, if not the largest, outbound medical tourism marketplace in the next few years. You know, it's estimated they send about 60,000, you know, patients outbound per year. But I think that's going to be in the hundreds of thousands in the next few years. May even be larger than that. No one's really tracking it. You know, 66% of China's 1.18 million wealthy millionaires would consider medical tourism. And that market is really, really growing. And I know Lisa touched, you know, on a lot of these points. You know, but, you know, China is one of the most difficult markets to enter from, you know, whether you're an international healthcare provider, you're an investor, you have some kind of technology. You know, we've seen a lot of organizations invest significantly in China, whether it's opening offices, building projects, or identifying representatives or consultants to penetrate the China market, where those organizations have been burned. You know, they've chosen the wrong partners, they've lost out on their investment. You know, they've had issues with IP. So the reality is it's all about having the right partner to take you into China. And as Lisa said, you know, the right law firm, you know, who's going to guide you along with that path. You know, it's not a market that I really advise that someone just goes and enters, and you really, when you're looking at who you partner with over there, there are a lot of consultants, and this happens in a lot of different markets who you'll reach who they'll say, you know, we have relationships with the governments or the hospitals and pay us, you know, a monthly consulting fee, you know, and we'll help you get those hospital management projects or build projects, or help you get patients, when in reality you pay them the money and you don't get anything in return. So really, it's, you know, if you're going into China, you need to be really strategic, really think it out. It's a long-term initiative. It's not something, you know, where you're going in there, you know, and you're getting, you know, tremendous amounts of business immediately or getting rich. It's one of those where you have to create a sustainable long-term initiative, and you could be really successful. There are a tremendous amount of Chinese facilitators who the Chinese patients are using, and we're just seeing an emerging market for this. You know, I would not be surprised in the next year or two if we see that there's thousands of Chinese facilitators sending Chinese patients outbound out of China. At our last conference, we had a lot of the large Chinese facilitators at our conference, from the ones, you know, that have a store in the luxury mall and charging patients $10,000 to bring them into the U.S. You know, there's different levels of Chinese patients. There's ones that they're the super rich, and price is no object, and they don't even need any negotiated discount or pricing at a U.S. or European hospital. They're willing to pay full price. You know, and then you have the other ones that are a little more savvy, and they're looking for quality but affordability. So I think there's a common misperception that we hear a lot of Chinese patients won't travel abroad, or they don't want to spend money. It's the exact opposite, and that's why you see a lot of Chinese investors or healthcare groups partnering with U.S. or European healthcare providers to build out these modern facilities. And China is investing significantly in IT and life sciences and biomedical and medical technology. That's increasing significantly. Telemedicine and mHealth is going to be one of the biggest growth factors of China in the future. It's very difficult of how to penetrate that market, but it is going to emerge very fast. You've got to adjust to how are you going to adapt to the culture of China, especially if you're coming from the West, and how do the West and East meet? How do you build on those relationships and build trust? It's definitely not a marketplace where you're going to do business and build relationships over the phone and email. You have to go there. It can be difficult for communication back and forth between China, whether they're receiving your emails, whether they have access to the web to even know about your organization. There's a lot of brands that aren't known in China because of web accessibility, and then even dealing on Skype sometimes there can be bad Skype connections. So it's a market where you have to have, be there in person meeting the people for you. So, the Medical Tourism Association, we've been, spending the last several years identifying who are the trustworthy business partners, what are the high yield opportunities, how to strategically position this, and then also assisting companies in entering the China market and being the intermediary, working with, law firms to help, negotiate and get the best terms for the agreements between the international healthcare provider and the investor, or the technology company and the Chinese partners, managing the relationship the entire time. And that means understanding the expectations and the ROI that both parties want, and making sure that's achieved throughout the entire process. So that is I think one of the most important factors, where some organizations go in and they don't have an intermediary, and there's two different expectations, and there's no one to resolve issues or to keep things aligned. And so relationships can get sidetracked, or different parties might have to exit the relationship because it's not just working. And so you definitely need an intermediary. So last year, we had one of our trade missions into China, November 14th to the 16th in Guilin, China. And then we did some trade missions into Wuzhou and Hainan and several other destinations in China. We brought in all the large Chinese medical tourism facilitators who were sending all the patients abroad. We brought in the hospital groups, the investment companies for B2B networking, and also B2G networking with the government. For whether it's hospital affiliations, academic partnerships, continuing medical education, strategic advisory services, hospital build projects, JVs. These are all different projects that we get into. While our organization is called the Medical Tourism Association, we get involved in a lot of global healthcare and investment and build projects, because there is no other organization that does that. And also, in different parts of the world, you'll see where the governments call medical tourism anything having to do with the investment in healthcare quality and the development of it. And interestingly enough, the same governments that are investing in building out the healthcare quality are the ones actually that are looking to send patients outbound also. So these are just pictures from our trade mission in 2015. This is the Cleveland Clinic meeting with one of the Chinese government officials. And also, so for this year, in I think it's almost a month and a half, we have our next conference and trade mission coming up. It's the World Medical Tourism Congress Boao in China. It's June 3rd to the 8th. The website is ChinaMedicalTourismConference.com. A little bit later, Bill will share with you some of the big hospital groups, investors, that are coming to China. It's, really an amazing opportunity. It's also a beautiful island. So you're going to have a lot of senior executives. Just looking at that picture, actually, it makes me wish I was there right now on the beach in Hainan. There's the Boao Lecheng Medical Travel Pilot Zone, and that's a big opportunity for partnership, where the Hainan government and private sectors have injected about $7 billion US to attract collaboration from international healthcare and hospitality firms to develop China's first healthcare city. The pilot zone already has 14 high-end projects, from acute medical care, stem cell, and rehabilitation to high-end hotel and resort development. So I really invite you to come. Depending on who you are in the relationship, we do have a hosted VIP program where potentially you can have airfare, economy airfare covered to travel there, and also 5-star hotel accommodations, not just in Hainan, but our subsequent trade mission that will go to 1 or 2 major cities for more B2B and B2G meetings. So I highly encourage you to come, because on the trade mission too, it's not just meeting the Chinese investors and group, it's also creating relationships with the other people on the trade mission and creating lifelong friendships and business opportunities. So I really appreciate, everyone coming on the webcast. We're going to jump into the questions now. If anybody has some Q&A, you can type it into the box on the screen. Also, we are going to, we have recorded this webcast, and we will be sending it out after to everyone. And what I'd like to do is turn it over to Bill Cook, who's in charge of our business development and initiatives in the Asia Pacific, and he's helping run our initiative at our China conference, and he will have any questions from the audience. Now, also, if you're looking to potentially be a speaker at our World Medical Tourism Congress in Hainan coming up in a month and a half, where you want to be involved in the buyer mission, you can reach out to Bill Cook. His email is bill@medicaltourismassociation.com. If you're interested in anything regarding sponsorship or exhibit booth, you reach out to Charlie Rodriguez, whose email is charlie@medicaltourismassociation.com. So with that, I will turn it over to Bill Cook.
Hello, thank you, Jonathan, and thank you, Lisa. Yeah, we've got a few questions coming in here, and so I wanted to, here's one that came in just a little while ago, and maybe this is for Jonathan or Lisa, whoever wants to answer this. There's a common perception that low price is a driver for most medical tourists. Is this the case with the majority of Chinese patients traveling to Western hospitals? Have someone asking about that?
Lisa, would you like to answer that question, or would you like me?
I would say, remember, if they want to go for lower cost services, the Chinese population don't have to come to the United States. And there are a lot of Asian countries that have very successful medical tourism, Thailand, Malaysia. And what we are seeing really, folks that come to the United States are in the following categories. One is really affluent population coming in for very high-end health executive check. But that's really getting to be more of the minority now. What we're seeing is really they are seeking out the top quality services. So for example, people will go to one particular hospital for cardiovascular services or for orthopedic services, and or cancer treatments. So these are what we're seeing in terms of the trend in terms of medical tourism coming out of China. I don't believe they are price sensitive if they choose the United States as a destination facility for services.
Okay, thank you, Lisa. I think a follow-up question to that maybe would be what challenges do Chinese patients face, do you think, when they're seeking medical care outside of China? What are typical challenges when they're seeking at hospitals under the U.S., Europe? Maybe hospitals who are on the webcast today could, yes.
I think language is a big part of it. Logistics side of it, also a big part of it. Also not knowing how healthcare system works in the United States. And this is why I think a good facilitator can really be helpful in that regard. And also, in the United States, I think you need to work with the hospital that basically have already set up that medical tourism system, because we all know sometimes they may only have 2 weeks time to stay in the United States because they're restricted by their tourist visa or their work schedule or life schedules. and you need to be able to schedule a lot of appointments within that window. Many large health systems that take care of the executive have these kind of executive health system that's set up so that basically we can take care of really that based upon more of a patient-focused approach to coordinate all the services required by the foreign population. So I think that's really the challenge. And so in that space, I really think the health facilitators in China or in the United States can be very helpful to make sure that to provide that education information prior to the purchase of the services and during the purchase of the services.
Lisa, a question came in from team that says, it's two questions. Who is the primary agency directing national policy in China for healthcare? And is there a strategic national policy paper developed to provide a backbone for efforts going forward?
As I mentioned, the National Health and Family Planning Commission, which basically is the current agency that's leading, spearheading all the reform initiatives, if you may. And we, in my industry, the legal industry, we always joke that China has the most laws of all countries we have ever dealt with. And so it's not a surprise in the healthcare area as well. So I think in terms of the Notice 2444 has clarified really Chinese government's policy with regard to the foreign invested or foreign collaborate in terms of the healthcare development. And I think we're going to see more and more of these kind of a policy being implemented and based upon really the needs of the industries and the communities. And I haven't really found one good white paper. I found some books that basically talk about healthcare industries, but I have not really found one good white paper. But I will definitely look after this webcast. If I find one, I will provide it to Jonathan to make it available to the members.
Great. Bill, I think we have just time for one more question. Is there another question that came in?
Somebody's asking what type of Chinese companies will be attending the June conference. As John mentioned, I think I'll answer that. Our conference is, June 3 to 5 is the actual conference, and we'll have the trade mission ending on the 8th. I mean, we're having private, public hospitals in China will be there, like Chinese medical tourism facilitators. We expect potentially more than 30 large facilitators in China attending the conference, international insurance, senior care, spa, hotels, high-end hotels, anti-aging. So all these type of companies will be there. I mean, some of the names that we have: HNA Healthcare Investment Management Company. They're one of the largest investment groups in China, multi-billion-dollar company. Evergreen International Medical Center. We've got Beijing, St. Lucia, which is one of the largest facilitators. So we're going to have really some top quality organizations at the conference. And like John said, you can contact me at bill@medicaltourismassociation.com after this webcast or any time. I'd be happy to discuss with you the opportunities.
Great. Lisa, any parting remarks you'd like to share with everyone before we conclude the webcast?
Sure. I wanted to basically say the efforts of, Medical Tourism Association and Jonathan, these organizations, it has been really very impressive. And I think it's really through this coordinated effort is that platform that kind of bring everybody together. I think this is really what China market needs. And I think this is really events like the symposium in Hainan is going to provide a lot of those networking opportunity as well. I think the window for the development, for the opportunity is really now and potentially for the next, 5 years. Then I think the space is going to get, will be more and more participants. So I think this right now is an excellent opportunity to participate, to get involved, and to explore, to network. And so I wanted to congratulate for MTA's efforts of doing that. And I hope to see everybody in Hainan in June.
Thank you, Lisa. I really appreciate that, and I really appreciate you taking time out of your very busy schedule to come to our offices to do this live webcast. Lisa, if any of you need, really great attorney who has tremendous experience, in the healthcare space and understanding how to structure these relationships with between China and U.S. healthcare organizations. She's really the go-to person, and I feel really privileged that she's sharing a lot of her IP and knowledge and expertise with us. So thank you everyone for attending. Hopefully we'll see you in China, or if not, at one of our upcoming events in either Abu Dhabi in November or our big annual global conference in Washington, D.C. in September. So everyone have a wonderful week and take care.
Thank you.
Excellent. Thank you so much.